We're going to try our best to hit that. Hey everybody, it's Will Kirkpatrick with Corsetta Nursing. Today we're going to show you how to insert an IV using Corsetta VR, our virtual reality nursing simulation system. So let's get right into it. So in the simulation, we are to put an IV into this patient as ordered by the physician. So we have our IV supplies ready to go for you guys here. So let's go over the steps that you'll need to do to insert an IV properly. First things first, we need to know what we actually need during an IV insertion. So what we'll need, of course, is an IV. And then we'll need an alcohol device to clean the site, and we need an extension tubing, we need a dressing to secure the IV, we'll need a tourniquet to help the veins pop up for you to make it easier to insert the IV, and then we'll need a flush to make sure we're flushing the extension tubing before we actually attach it to the catheter. So all of these supplies you will need for an IV insertion. So let's get right into it. So the first step is usually to apply the tourniquet. So I usually tell my students to apply this right away as your first step because while you're getting your supplies ready, you're allowing those veins to kind of pop out for you to make it easier. Let's go ahead and take this patient's gown off to make it easier to show you guys. So it's very hard to see, but one of the most important things, guys, is actually vein selection. Now, of course, practicing makes perfect with IV insertion, but actual vein selection is also just as important. So you need to know how to find the right vein. Now, seeing things is one thing, but I would not always go off of what you see. So what I would do is actually palpate the arm to see which one really feels the best. So which one's big by palpating. So of course, a common site is that AC vein right around here. But sometimes you'll have patients with big forearm veins as well. So you can kind of see the veins here, but I would definitely go for the one that is easiest to palpate because that one will be the easiest to insert. So vein selection is very important. That's usually your first step. Tourniquet, and then look at your veins on your patient to see which one you want to try for the insertion. And then next, of course, is alcohol device. Now, before I even touch this patient, what do? I want to wash my hands and apply gloves, especially when you're putting an IV in, you could be exposed to blood. So I'm going to go ahead and start cleaning the patient's site. So we're going to go ahead and choose the AC vein. Alright, that site is clean now. Now, in real life, you want to make sure you're scrubbing, right? So I'm going to go ahead and grab this again. I want to scrub in a circular pattern from inward to outward to make sure that site is clean, and you want to allow that site to dry completely. Alright, so the next thing I typically do is prepare the extension tubing. So the last thing you want to do is insert that IV and not have everything ready to grab afterwards, because your patient could potentially bleed all over the place if you don't have everything ready to attach. So you definitely want to get this extension tubing prepared. Now always remember to flush this out, because if you don't flush it, you're potentially pushing air into that IV site if you don't prime the IV extension tubing. So we're going to go ahead and flush at least 3 mLs. I usually wait until I see a drip come through. Hey guys, it's Will Kirkpatrick, nursing educator inside Corsetta. I wanted to let you guys know that I will help you with anything you need at any time if you just send me a text at 940-218-4062, 940-218-4062. Let's get back to the video. But about 3 mLs is when you'll see that happen. Alright, so this is ready. So I have that ready in reach. So the dressing's ready, so we're going to go ahead and grab the IV, take the cap off, and we're going to get ready to insert this in. Now, of course, VR, the dexterity is not necessarily there like you would get in real life, but the mental repetition of this simulation will help you out in understanding the steps. So what I would do typically, so I would palpate the vein above where I'm actually inserting. Definitely don't touch it again, because then you just made the site dirty again. You'll have to clean it. But palpate above and kind of have that as your aiming point, right? So you want to insert below where you're actually touching, of course. And there's a lot of different ways to do this, but this is typically how I do it. I want to control the arm. Depending on the type of vein, I'll pull the skin to make it more taut, I guess you could say, where the vein is not going to move as much, especially if they're rolly veins. But what we're going to do for this simulation is we're going to hold the site above, and we're going to try our best to get that vein. Now, it's probably pretty hard for you guys to see this, but we're going to try our best to hit that. Okay, and then after you get that site and you get a flash, you then want to start inserting that catheter. Okay, so it's inserted, and of course we want to make sure that we want to throw that in the sharps immediately. And then what's our next thing? immediately make sure you guys are holding this site so that way it's not bleeding everywhere. Grab your extension tubing and attach it. And then depending on where the site is and everything like that, I usually flush and then pull back to test the site first before I actually dress it. So I push and then pull back. And you see some blood return there in that extension tubing. So I'm going to go ahead and flush that all the way through. The site looks okay. So let's take that off, and then now we're good to dress it. I usually wait, but of course there's other ways to do that too. If you feel very confident about the site, then you don't have to wait. But I usually like to flush it and then pull back just to make sure it's the right site. And then of course, take this tourniquet off. Don't forget to take the tourniquet off. So that right there, guys, is the simple steps of how to insert an IV in virtual reality. Thank you guys for watching. See you in the next video. Hey guys, first of all, thank you so much for watching the video entirely through. It makes our day if we know that nursing school got a little bit easier after watching one of our videos. If you guys like this video, make sure you like it, subscribe to the channel for more, and drop down in the comments for any more ideas that you need help with nursing school. If you want to contact me personally, it's 940-218-4062. Thank you guys for watching. We'll see you in the next video.